Good morning, good afternoon, good evening. I am Eric Shiraev. We continue our journey into psychology. And those of you who study these lectures in sequence, we have studied anxiety disorders. And today's lecture will be dedicated to mood disorders, another interesting and important subject. However, you can watch this lecture, study these materials by itself, by the file by itself. The topic is very interesting and can be also studied together with many other psychological issues and problems. Well, as always, I will share with you the screen and also recommend you at the end, you can have access, you will have access to 5 multiple choice questions to refresh your memories about this video. Thank you, TutorDudes, again for helping with this video. And I think the materials that we will study today will be important, useful, insightful in many ways, and well, they're all relevant to our lives, all relevant to our daily activities. Let me share a screen with you this moment, and we begin. This is a topic called mood disorders, and right away I will say that most of the time we'll discuss depression or major depressive disorder. I'll spend some time discussing bipolar disorder, but mostly we'll discuss depression. It's a colloquial name for major depressive disorder. This disorder is viewed by American Psychological Association, by American psychiatrists, within the category of mood disorders. And what is mood? Those of you who study psychology, you take any psychology textbook and you realize, well, there is no mood there. We study emotion, we study motivation, we study sensation, perception, etc. But there is no chapter on mood. How can we talk about mood disorders? You're right. This is an interesting situation, that a mood is really a loose term in psychology. It stands for long-lasting emotional state. In other words, a combination of your emotions, which state of emotions lasts for some time, and then you and I, we as human beings, we then define our emotional state. How do we define our emotional states? We call it mood continuum. We define this in mood continuum. Most of us, most of the time, describe our emotions and as a state of our mood is either happy or sad or neutral. So neutral indicates that you find you neither happy nor sad. It's most of the time, most of the day, most of us are in a state of neutral mood. Sometimes we're happy for a reason. Something happens, something is happening, something is going to happen. Sometimes we're sad, something has happened, something is going to happen, so we feel sad. Sometimes we feel happy or sad without any particular reason. Sometimes, you wake up in the morning and you grumpy, you're upset about something. You don't know why. Well, it's maybe sad, maybe unhappy, but something that's a negative mood, positive, negative mood. That's a normal continuum in our lives. Well, okay, fine, big deal. Let's say that is our life, happy, sad, neutral, plus, minus, positive, negative, so what? There are states of our mood which are looking at the sidelines, kind of on the sidelines. They become or begin to resemble something which is not normal. Remember, one of the signs of mental illness is abnormality. So something abnormal, dysthymic. Dysthymic is not a very common term in English language, but professionals, medical professionals, psychologists use this term all the time. Dysthymia as a noun, dysthymic as an adjective, refers to mood which is mostly it's sad. You feel down. It's not just for 5 minutes, but 10 minutes. It could last hours, sometimes days. We call it feeling blue, feeling sad. So those days in our lives, those weeks in our lives. On the other side, we talk about hypermanic mood. So happy side, hypermanic, persistent disinhibition and mood elevation. Persistent disinhibition. So you don't have inhibitors. You laugh, you talk loud, you feel that everything is possible. Life is great. Everything is really, really good, fine, awesome. Somebody will ask a question, but what's wrong with it? So are we all human beings? We got to be sometimes hypomanic, sometimes dysthymic. And why, Professor, talking about problems? Well, I'm not talking about problems. I talk about, well, the state of our mood being slightly off what we expect from people. So we expect a person to be sad for a reason. We understand that some people can be sad for no reason at all. We understand that too. But when a person is unhappy and sad for several days in different situations, and we feel that she or he's not supposed to be sad, we notice it. So it's slightly different from what we expect in a given cultural, social, individual circumstances. Same thing about hypermanic mood. What's wrong to be happy, of being happy, of being outgoing, of being optimistic, of being well, overly great, and hoping everybody is great and the world is great, is what you believe. No, it's not, nothing wrong with this, but when we think constantly, when we act constantly for several hours, several days, and there is no particular reason of feeling this way, well, this is slightly off, right? We have to be happy for a reason and for a particular time. So, but these are states of our mood which are still within well, we can normal state of mood. Problems begin with this. When we do have extremely or extremely extended or deep states of sadness. It's not dysthymia, which comes and goes, feeling blue, feeling sad for some time. It's serious problem with sadness. And this is what we call abnormal. I'll tell you more about these depressive episodes and why episodes. I will tell you more about this in a few seconds. On the other hand, the mood continue. We see manic episodes. So an extremely exaggerated state of happiness, which really contradicts what challenges the way the person's supposed to behave, supposed to act, supposed to think in given circumstances. We always need to understand that. So we live in particular conditions, in certain contexts. You must place an individual in those contexts. People can be extremely happy, extremely sad for a reason, but those reasons must be identified. And in general, mood disorders, or mood disorder, known as a mood affective disorders, is a group of conditions identified by professionals, not by everyday person who is just knowledgeable, which we can guess, but these disorders are diagnosed, as far as remember, by licensed professionals in the United States. So this is a group disorders which was studied where disturbance in the person's mood is the main underlying feature. So disturbance in the person's mood. It's clear, must be clearly abnormal, must be clearly dysfunctional, and must be clear distressful. So it's pain, emotional pain, suffering, affects person's life and effectiveness, efficiency in life, and also clearly abnormal compared to cultural, social norms or expectations. But what are these, and what's these disorders, and how can we identify them? Major depressive disorder, a problem which affects millions of Americans as we speak, affecting right now, and tens of millions of people around the world, if not hundreds, every given day. That many people are affected. And major depressive disorder is identified as a series of major depressive episodes. It's not like long and unchanging sadness just for months and months and months. Could be, but it's not what say like typically identified major depressive disorder is. This is a series of major depressive episodes which come and go, but major depressive episodes are clearly identifiable. What are they? Major depressive episodes will introduce you a number of symptoms. Not all of them will not fit this slide, but a number of symptoms which a trained and licensed professional observes, measures, identifies, and then make his or her diagnosis. And will certainly believe that if you want to learn more, of course, you can get back to this part of lecture and examine the symptoms again. Well, what are they? Sadness most of the day. Sadness most of the day. Instead of being unhappy, hopeless, helpless, guilty, and sadness has so many faces, can be expressed in so many ways by different people, which I will also mention in a few minutes. Intense feelings of guilt. So separately. Guilt for what? Well, guilt has so many faces here in this under these conditions. Guilt can be about being seemingly so healthy and so much falling apart right now, having depression. Guilty for taking too much time from relatives and friends who help you. Guilty for not fulfilling your promises to yourself, and you want to achieve so many things, and look, depression, and I'm nobody, I'm nothing. So lots of diminutive thinking about self, and guilty feelings about self. Loss of enjoyment or interest in pleasurable activities. We as human beings, vast majority of us do have a number of pleasurable activities, things we like to do. It's reading, it's exercising, it's talking to friends, spending time with the family, building, constructing something, researching, writing. We do have those activities, watching, but loss of enjoyment of almost all pleasurable activities. None of activities become pleasurable. Lack of motivation. There's no desire to get up in the morning. There's no desire to go to bed in the evening. There's no desire to eat. There's no desire to control your weight. It's amazing that people often say that people who go through depression, they gain weight. And they always ask if there's a lack of motivation. People don't like to eat. People who go through a stage of depression, how come they gain weight? Well, because people eat and still eat and indulge themselves, eating fattening food, eating unhealthy foods, yummy, tasty, but not healthy, and lacking a desire to control the calorie intake in their bodies. Well, that's why many people gain weight. Many people lose weight because they stop eating or reduce food intake. Sleep disturbances, from inability to fall asleep, sustain sleep, to excessive sleepiness during the day, during night. So it's serious sleep disturbances. Difficulty concentrating on any task at hand, indecisiveness. I frequently tell my fellow students that to say that a person, a friend of yours, look, you have depression, I guess, go and see a doctor, go and see a psychologist. And they say, yes, we do, I will do. And they don't. So it takes us, our courage, our time, and simple decision. Let's go take the person's hand and go together to see a professional. If you believe that your friend or your loved one in your family has symptoms of depression, it's nothing to be ashamed of and nothing to be afraid. It's a serious illness which is treatable. So indecisiveness is a very important factor we must understand. In recognizing people with depression. Suicidal thoughts, it's a really heartbreaking topic to discuss. Depression is one of the major contributors to suicide across the world. Depression and substance abuse. Unfortunately, it's the two factors that are deadly, and we need to understand this and need to recognize this and be very careful about this. Yes, culture affects suicidal thoughts. People who are devout religiously, rather, people who, yes, practice religion, less likely to have suicidal thoughts. Research cross-cultural shows this. And also pains, like in anxiety. Remember, talk about anxiety disorders are associated with multiple pains. This is how the body responds to stress, to anxiety. Same thing, depression. Pains in joints, abdominal pains, back and chest pain, neck pain, headaches. They're constant and typical to accompany depression. So there could be other symptoms right there. You can easily find them in reputable sources, but I give you just basic cluster of symptoms. And not all of them must be there. Usually 3/4 of symptoms should be identified in the person who is considered, who is under your observation if you're a clinical professional. So there we go. This is how major depressive disorder looks. Periods of normal mood accompanied by major depressive episode, which lasts for approximately 2 weeks, give or take few days, approximately 2 weeks, plus minus. And the person goes back to normal and then goes back to major depressive episode. But usually people diagnosed with depressive disorder after several such depressive episodes. You can just go follow a letter and say 2 letter of rules we follow, but usually it's more than 2. People don't go to see a professional after 2 episodes, usually, although they may. So it's series of those episodes. And this is not just behaving normal mood and then sad, normal mood and sad. No, major depressive episode is a serious and devastating condition, which indicative of depression. Symptoms range from mild to moderate to severe. Reminded, mild symptoms are usually those that we can control ourselves with knowledge and skills and help. We can manage those symptoms. Moderate symptoms require medical, psychological intervention. Severe symptoms require urgent care for this individual who has those symptoms. And like in every psychological disorder, just we must distinguish between at least these 3 stages in the range of disorders. Causes. I cannot explain all causes right there, but it is common in psychology to distinguish several clusters, but I just distinguished only 2 for convenience for us. Of course, biological. Something in the brain and nervous system must be taking place to cause symptoms of depression. We understand, right? Something must be taking place. And we can refer to neurotransmitters like serotonin, and it's a functioning of transmitters in the brain. Some neuroscientists point out disruption of biological rhythms in the body, so brain begins to act in a way that's we go through sleep stages every night, 8 hours, 6-8 hours. We're all sleepy, and then our circadian rhythms. We study them, studying consciousness. Here is disruption of those rhythms. And it makes sense, right? The person who goes through a stage of depression feels like as if he or she is about to fall asleep. Not trying to simplify things, but again, slowing, just not paying attention to things, and just being not really happy about everything. Also, sensitivity of emotional related brain areas means that's small disturbance, small unpleasant news become exaggerated and become factors in a person's responses to those events. So biological, closely connected, psychological, they interconnect. What kind of psychological factors we talk about? A learned helplessness, the conditions in which individual, despite his efforts, still cannot get things done and be successful. Misperception life, blaming others, blaming society, blaming self for mistakes when there must be something else found, and find ways to overcome difficulties must be found. Social circumstances. It's so easy to say it's go embrace and study and be well, but what if person is out of work for many months? What if a person's health is under serious threat? What if the serious unfortunate events strike his or her family? So it's, those things, they may have a serious impact on our life. So the combination of factors is what psychologists pay attention to: social, cultural, biological. And when people ask you, what causes depression? Why is she depressed? Well, don't say this. We know one reason. Usually there are many of those reasons that are interconnected. Some facts about depression in gender. Not gender differences in depression, boys and girls found. Depression is diagnosed in boys and girls. Females are affected about twice as often as males during adulthood. In the United States, a number of factors affect these results, and yes, there are sex differences between men and women. and also diagnostic biases, is how professionals diagnose depression in males and females, but that's a fact. Women compared to men tend to have a greater proportion of somatic symptoms such as loss of appetite, sleep problems, pains, as well as anxiety. Men in the US have more report psychological symptoms. So why? It's a separate subject to discuss, and it's again cultural and gender-related issues, and many interesting other factors affect this. But this is what it is. But I put here women tend to have, doesn't mean every woman has same symptoms, every man has same symptoms. Differences are just statistical. And also important fact that we distinguish postpartum depression, which affects about 10% of women after they give a childbirth. So 10%, it's not a woman's fault, as some think about, well, you gave a birth, come on, put yourself together and stop crying and go ahead and move on. No, it's not about choice of having depression, not having depression. This is how the body and brain respond to this wonderful, great events in our life, the childbirth. But this is the response. 10% of women suffer from symptoms of depression, postpartum depression. Treatable, but we must be careful. Some grandparents and parents blame young mothers for not being strong enough after giving birth. It's not mother's fault about this. Depression age. People, all ages have mood disorders. Younger people, older people, mature individuals. It's harder to diagnose depression in children because they often cannot express how they feel. So ask 5, 6, 7-year-old, they may say something about it, but difficult for them to express themselves. In the elderly, depressive symptoms often comorbid or coexisting. They coexist with other psychological symptoms. So that's why often difficult to simply separate depression from, say, anxiety or some eating problems or other illnesses. Depression cases increase after the age of 65 in humans. Reported pains increase, and sometimes pessimism and dissatisfaction and many other factors affect people over 65, and well, at least what we know, the depression cases increase. And in the elderly, depression is often overlooked because people close to them believe that depression in older people is normal. Saying, well, she's 75, yeah, she's lightly depressed, and some people even say sarcastically, what do you do? These old people, they're supposed to be depressed. No, they're not supposed to be depressed. And it's a clinical condition which must be taken care of. So we can help, and professionals do help individuals of all ages with their problems. A couple of words about bipolar disorder. It's relatively rare. You can check numbers of depression, which of course vary from study to study, but we talk about millions of Americans to have affected symptoms of depression. Numbers can vary. Some reports say, well, 5%. Others say, no, at least 15%. Because other cases will go underreported, but substantial number of us can have depression, unfortunately. Bipolar is really rare, talk about fraction of percent, but devastating issue. Bipolar disorder used to be called manic depression or manic depressive. It's a disorder with the periods of depression, so major depressive episodes, and then manic episodes. So it's sort of like a zigzags, ups and downs in the symptoms. I put here a description of a manic episode. It's not just being happy and talkative and elated. It's about unreasonable happiness. And usually typical manic episode lasts several days, 3, 4, 5, 6 days, not a week, as 2 weeks, as a major depressive episode, shorter periods, but really marked periods of euphoria, inflated self-esteem, feelings of grandiosity, being big, being omnipotent, capable of anything, talkativeness. It's about talking and posting and chatting and posting and discussing things. It's about TikTok, Instagram. It's lots of presence right there, excessive presence right there. Flight of ideas, So like fireworks, they're being fired, and they like flashes and come and go, distractibility. So from everything becomes a distracting factor for individual. Increase in goal-directed activities. So there's certain things that start doing and continue doing, and usually self-destructive issues, gambling, and unfortunately eating and drinking of alcoholic beverages, using drugs, risky behaviors, decreased need for sleep. Individuals reported can spend 2, 3, 5 days with just only few hours of sleep in between acts of activities, and also recklessness between periods of activities, and also recklessness in driving and making decisions, and violent outbursts. In mild cases, yes, you see a person is really euphoric, you elated, and usually strange and talking and behaving. But there's serious cases which manic stages require hospitalization. It takes even some time for professionals to distinguish between manic episode and being influenced by drugs, or going through a more serious psychotic breakdown, which we'll study later on in this class. But overall, when we talk about mood disorders, and this is again typical bipolar disorders: in normal mood, depressive episode, manic episode, and period of normal mood, depressive episode, manic episode. So difficult to treat bipolar disorder. As medications are available, method treatments are available, but it's very difficult to treat, and many individuals suffer, will go into remission, but suffer for many years. But there's always hope in our lives. Always hope in our lives. Speaking about mood disorders, I should say that the only two I introduced to you, mostly focusing on depression. I should raise awareness that mood disorders often accompany other serious behavioral problems in us. And the one I mentioned about suicidal behavior, and this is really dangerous. We must take depression seriously, and shouldn't say that person is sad, it's not our business, and everybody deserves to have some sad days, and who am I to help? We are there. We are here to help. We are there to help, and we must help. I don't want to be intrusive. We should be intrusive in helping individuals, because remember, mood disorders affect our rational thinking, affect our ability to help ourselves, affect our ability to be engaged in healthy behavior. Back to normal, and it's only relatives and good friends capable of taking the step and bring people who have depression to professionals. And also be aware of your own symptoms. Always talk and always report, communicate, because health professionals are there to help us, and so there to give us good advice and treatments whenever we ask for help. So in the future lectures, if you follow lectures, we'll discuss other forms of mental illness, and we discuss also therapy and prevention of mental illness. Those of you who want to check your knowledge, the questions available about this lecture, multiple choice, to refresh your memory. Thank you again, TutorDudes, for recording this lecture, and see you in our other classes. It was Eric Shiraev. Thank you so much for your attention.